The problem with PACES is that if you look really pretty, but you don't pick up the facts that you need to find, you will fail. Equally, if you pick up all the facts that you find and you get the right diagnosis, but you don't do it in a certain way, you will also fail. Hello guys, long time no see. If you're new here, my name is Dan. I'm a doctor working in London and I also teach PACES. A lot of people liked this video that I did going through my whole PACES exam. It's pretty long, but I have been told it's quite useful. But ever since I made that video, I have been teaching PACES at my hospital here down in London at St George's. And I have recently set up something called the PACES Academy, which is going to be an online community that I'm going to tell you about. Last Sunday, I hosted a webinar, and this basically is going to be the TLDR, or the summary of the things that we talked about. If you were unable to make that webinar, it was basically about how to revise for PACES, how to approach the PACES revision. I think this is something that people don't think about very much. A lot of people go to courses, a lot of people read, very specific books. It's all about knowledge, it's all about very rare diagnoses. No one takes a step back and says, hey, this is how you actually approach this exam. Now, having said that, PACES is still hard, you can still get unlucky, but I do think there are ways that you can think about it and break things down, keep it really nice and simple. That's what I want to talk to you about today, but that was done in full last Sunday, so check out the webinar. It's totally free, and you'll get a bit more information there. So the things that we covered in the webinar were how to create your own revision timeline, the format of the exam, looking at the mark scheme, how to think about the PACES exam, planning your revision, and where to start. And then we also talked a little about who I am, how I teach, and how I can help. If you want all that, then go check out the webinar. The link will be in the description. Firstly, how I teach, because I think that informs a bit about the way to think about this exam. So when I was at med school, I, especially in the first couple of years, was not a very good student. I didn't turn up, I drank way too much, and essentially I had my priorities quite wrong. I ended up getting a letter home which sort of said where I was in the year, and it didn't make for good reading. I was something like 207th out of, 240 people in the year. So I was on a very, very solid third. And really, it took a very long time for me to recover from those first couple of years where I really didn't take in a lot of knowledge. And so I was then on catch up. And as a result, I wasn't very confident. I didn't know what I was talking about. And so teaching for me was this really uncomfortable thing where, realistically, I was probably going to look like an idiot because I didn't know all that much. And so I found it very intimidating. I then didn't want to go to teaching. And then I kind of got worse. And so all of this is to say that I think the relationship between the teacher and the learner, it's quite precious. When someone is learning something, they are essentially putting themselves in a vulnerable position. They are saying, potentially, I don't know, at worst, and at best, they're going to try something and then they may fail it. And that's really uncomfortable. And I think medical education tends to, not respect that all that much. But at the same time, the way I teach, I'm very honest with my feedback, but I think kindness goes a long way. You have to be really comfortable if you're really going to take on a topic, going to be brave enough to say, oh, I think it's this, if you really want to engage a group of people or anyone, then you need to have them comfortable and feel like they, can say what they think. So that is, one of the things I want to just outline, because I think that PACES is all about confidence. And so one of the things I highlighted in the webinar was the fact that actually in PACES, you have to think about the skills, you have to think about the knowledge, and a lot of people get really caught up on the knowledge, but you also have to think about the performance. And so when you are doing your PACES exam, I want you to think, actually, this is an act and I'm performing, but I'm also on a fact-finding mission. And the way to think about this is that I want you to pretend that you're a ballerina and a detective all at the same time. The problem with PACES is that if you look really pretty, but you don't pick up the facts that you need to find, you will fail. Equally, if you pick up all the facts that you find and you get the right diagnosis, but you don't do it in a certain way, you will also fail. And so that is really crucial to understand. And we went into the mark scheme a lot in the webinar, so I really recommend going and checking that out, because the mark scheme is literally the thing that is going to decide if you pass and fail. And very few people ever look at it. So please go ahead, have a look at that. But that is one of the most important things that I wanted to get across. PACES is an act, and you are a detective and a ballerina. So now that we've talked about that, I want to think about a bit more about this idea of skills, knowledge, and performance, and focus primarily on performance. And I'm going to bring it back to myself here, because the reason I told you about my first couple of years of university is that I actually managed to turn it around. So I graduated in 2017. That was from the University of Nottingham, and I actually graduated with honours in my final degree. So my undergrad degree was a total train wreck at the start, and I managed to, just about through a good dissertation, get it up to a 2-1. And then in my second degree, which was my actual medical degree, I managed to, I was a very average student, so I was getting around 61% in all of the MCQs. My knowledge wasn't, razor hot, but I worked pretty hard, and that was what I got. Then it came to our finals, and our finals were basically OSCEs, which are like these long form cases. Some of them were long form, some of them were short form, but basically you had to examine a lot of patients, do an A to E examination, come up with a history, basically it was a practical exam, and there were 2 of them. And the first thing that I did really well was that I was actually really lucky in that we had some really sensible housemates, and we made something called OSCE Society, or OSCE Soc. And this was a way of learning together. This was a way of actually it being fairly bearable, as well as, actually teaching one another. And it meant that we did it fairly regularly. It was one of these things where we'd come have OSCE Soc, and then we'd all cook dinner together or something like that. And we made it a bit more bearable, a bit more sociable. The fact that it was in a group, I think that really kept me very accountable. I never didn't turn up, and so that was far more effective than if I was just navigating this on my own. And the second thing that I did was, I don't know what came over me, but a couple of days before the exam, I basically thought about it, and I realised that if I was going to spend the next couple of days cramming, I would maybe gain 1% of knowledge. However, if I spent the next couple of days focusing on staying calm, researching, I literally searched on YouTube, how do you stay calm under pressure? That was something that I put in. And I was learning about all these breathing techniques, visualization. I was learning about power poses. And I remember in the exam, I had my hands on my hips in the corridor as I was waiting to go in with my chest out, and it helped. And the idea was that, yes, I could cram and I could get 1% more in my brain above my total knowledge. But the thing that is really going to move the needle on the day is that if I can stay calm, I can then display more of my knowledge that I already have. And that was a thing, that was a brainwave. I don't know why I decided to do that, but it worked. And essentially, I nailed both of my OSCEs. I absolutely smashed them. I got 80% and I think 91%. I think I came 10th in the year in one of these, exams. And what I really want to get across is that I was not a special student. I'm not a genius. I am just an average guy. And I ended up getting honours. So I got something like 69.7%, and the uni were like, yep, that's 70. And I got honours. And I must admit that was rather surprising. But it comes back to this idea of performance. It comes back to the idea of staying calm under pressure. And the things that I want you to take away and think about when you're revising for your paces is the fact that it is a performance, and the way to perform better is to stay calm and also to keep things simple. Okay, so when we're in ITU or when we're in A&E and we're in resus, what do? We do A to E. Why do we do that? Because it's simple. Everyone can just go through, when they're stressed, when they're under pressure, they can go through A to E. And that is what I also think you should do in your paces revision, is try and keep it simple. This is how I teach, and I really think there's some merit to it, but there are some other things that I want to talk about, but I'm probably going to put that in another video. The main thing that I want to do is go into that the idea of it being an act and maybe having different identities for each station. So check out that in the next video. I will link that here. Do go and check out that webinar. It's really important that you have a look at the mark scheme and we go through it in real good detail. And then the last thing to say is to just talk to you about the PACES Academy. So this is a community that I've set up. This is going to be an online platform, and you pay once and then you're in. And the idea is that we're going to get everyone in who is revising for PACES at this time. And I think it's going to be a fantastic resource. And basically what we're going to focus on is the stuff that isn't already covered. So there's really good courses, there's really good books. They all do knowledge and skill, skill sometimes fairly well. But what I want to talk about is performance. Talk about the exam technique. And when I mean that, I mean not your clinical exam technique, but how to approach the exam. There's things in the mark scheme that give you clues. I'm going to tell you one more anecdote. So when you get to your clinical systems examination, your cardio, resp, your abdo, and your respiratory, there is no marks for clinical communication in the mark scheme. And I see time and time again people at the end of the bed saying, hello, my name is asking about pain, and then they say, today I would like to do an examination of your heart. I'd like to start by having a look at your hands, and then I'd like to look at your chest, have a listen to your chest. It will involve some moving, and you're just wasting time because it's not in the mark scheme. And these are the kind of things that I get, you know, quite animated about, but I want to share that with you. That's what the whole community is going to be about. It's going to be about trying to get you across the mark, but also making it bearable, connecting with other people, keeping yourself accountable by being in a group. So that's the PACES Academy. You can find out more about that in the links below. But if not, check out my full guide here, and also check out this other video about the identities we adopt when we're approaching our PACES exam.